Welcome to section 19.1 of metabolism. In this video, we'll focus on memorizing the details of Tay-Sachs and Niemann-Pick disease. Let's get started. This scene will take place at the home of an ordinary man who has a nice big cherry tree on the side of his yard. Notice that there are a bunch of sacks around the tree that are filled with cherries. The sacks full of cherries are here to help you remember Tay-Sachs disease. So, sack full of cherries for Tay-Sachs disease. This guy heard some ruckus, so he came running outside with his gun. He's not very happy either because he was in the middle of something important. Let's zoom up so we can see what he was up to before he got interrupted. Oh, gross. He was picking his nose. That's kind of awkward. But the good news is that this should help you remember Niemann-Pick disease. So, picking his nose for Niemann-Pick disease. If we zoom back out, you can see that now we've added a giant lizard on this man's cherry tree. This is to help you remember that Tay-Sachs and Niemann-Pick disease are both lysosomal storage diseases. Lizard sounds kind of like lysosome, so we'll be using lizards in each of the lysosomal storage diseases to represent this idea. So lizard for lysosomal storage disease. If we go back to this view, we can see that this man is clearly using his finger to pick his nose. This is to remind you of the mnemonic, no man picks his nose with his finger. Finger sounds like sphinger and is here to help you remember that the deficient enzyme in Niemann-Pick disease is sphingomyelinase. So sphinger for sphingomyelinase. It will also help you remember that sphingomyelin is the accumulated substrate. Both sphingomyelinase and sphingomyelin sound so similar that we thought it would be best to just have one symbol for both of these ideas. So again, sphinger for sphingomyelin is the accumulated substrate. Okay, notice that we've shown a cane next to the old man with the gun. He's old and needs a bit of help getting around, but once he got to the door, he dropped the cane and pulled out his gun. The cane represents weakness because most people using canes probably have some sort of weakness that prevents them from not needing a cane. The cane refers to the idea that Niemann-Pick disease results in neurodegeneration, which is clinically manifested as weakness. The reason the man came outside in the first place was because of his loyal dog. Notice this Dalmatian howling and barking. If you look closely, you can also see that the dog has a little spot on its trunk that looks like a liver. The liver spot here should help you remember that Niemann-Pick disease results in hepatosplenomegaly. If we zoom up, we can also see that the dog is even foaming at the mouth. He must be really upset. The foam here is to help you remember that foam cells, or lipid-laden macrophages, can be seen on pathology in Niemann-Pick disease. So, dog foaming at the mouth for foam cells. Okay, before we move on to Tay-Sachs disease, I'd like to draw your attention to one more point. The spotlights on the house were turned on very brightly as the old man opened the door. Notice how the lights are shining on the cherry tree. This part of the image is to help you remember that a cherry red spot on the macula can be seen in both Niemann-Pick disease and Tay-Sachs disease. So lights on cherry tree for cherry red spot. Okay, now let's discuss Tay-Sachs disease. For the most part, all of the information on the right side of the image will represent Tay-Sachs disease. Notice this hexagon-shaped stop sign that got knocked over? This is here to help you remember that the deficient enzyme in Tay-Sachs disease is hexosaminidase A. The fact that the sign got knocked over should help you remember that this is the deficient enzyme. So, hexagon-shaped stop sign for hexosaminidase A is the deficient enzyme. The reason the sign got knocked over, the dog started barking, and this old man came out in the first place was because these punk kids were stealing cherries from the beloved cherry tree. These kids are in a gang and they like to go around stealing all of the cherries from the neighborhoods. The gang of kids here should help you remember that the accumulated substrate in Tay-Sachs disease is GM2 ganglioside. The fact that there are several gang members should help you remember that this is the accumulated substrate. So gang for GM2 ganglioside. This poor gang member was even shot in the leg. That old man must be pretty crazy to shoot a kid in the leg just for stealing cherries. This part of the image should help you remember that, just like Niemann-Pick disease, Tay-Sachs disease also results in progressive neurodegeneration, which is clinically manifested as weakness. Additionally, developmental delays such as the inability to walk may be a clinical manifestation of Tay-Sachs disease. So, the guy shot in the leg here should help you remember these ideas. Finally, notice that this lizard's skin is starting to peel off, kind of like how the skin of an onion peels off when you're cutting up an onion. This part of the image is here to help you remember that lysosomes with onion skin may be seen in Tay-Sachs disease. The fact that the skin is coming off of the lizard should help you remember that this pathological finding is referring to the lysosomes. So skin peeling off the lizard for lysosomes with onion skin. And that should be everything you need to know about Tay-Sachs disease and Niemann-Pick disease.